Mr. Deputy Speaker, it's been said many times, but we should never tire of saying our NHS and care workers are true heroes, and we are incredibly grateful for their skill, dedication, selflessness and sacrifice. We came out on Thursday evenings to applaud them. Now it is time to build a system that rewards them with more than applause, and that's why it's important that the government puts its money where its mouth is and starts to recognise them as hundreds of thousands of people in each of these petitions have highlighted and called for. A decade of austerity. With the decade of austerity, the NHS and Social Care system is on its knees. The government was already missing A&E targets as far back as 2015. And we also know that the NHS has vacancies of 100,000, and also the NHS trusts have 1.223 billion in deficit, which needs to be addressed quickly so that they can get on with the job of protecting us, as well as the mental health crisis. Mr. Deputy Speaker, across the system, across the NHS and care system, there's a scourge of low pay. Unison predicts that we'll need another 1 million extra care workers by 2025. It's vital we learn the lessons now and make sure we have a resilient, well-resourced, effective NHS where people are properly rewarded and recognised, where their skills and expertise is recognised rather than being treated shoddily, which is what we've seen. We also need the government to make sure that junior doctors are properly rewarded. Their behaviour in recent years was appalling, and yet these doctors, nurses and carers have been the people on the front line saving people's lives and protecting us. And we also know that BAME, NHS workers and care workers have had the highest death rate, and yet the government has been inadequate in protecting them. To be frank, the government has treated them like cannon fodder, and the fact that it doesn't have proper recommendations is scandalous, and they need to get a grip before more lives are lost. If the Minister thinks health workers and care workers should be protected, she should act instead of saying appalling things about them. And I hope she'll apologise for the remarks she made recently about care staff. The point, Mr. Deputy Speaker, is that we need to ensure that this government, when this crisis eases, doesn't forget the sacrifice and the commitments people in the NHS and the care system have made, that it acts to ensure they're properly rewarded and properly recognised and that they are protected.